Hi, my name is Lisa Scherr, and I'm a nurse practitioner working at the UCF Health Center in the Gold Pod. I specialize more in primary care, and I have been here for 10 years. I'd like to talk to you about simple cystitis. Now, it does affect both men and women. However, it affects women more. It is an acute bacterial infection affecting one's urinary tract. As you see with this simple schematic, the urinary tract includes kidneys, ureter, bladder, and urethra. The reason why women get more infections than men is because we have a much shorter urethra. What are the symptoms? Typically, symptoms of a urinary infection is dysuria, which is painful urination, urgency, and frequency. Sometimes also you can get hematuria, which is blood in the urine. Suprapubic pain includes pain in the bladder area. When you press, you might feel some bloating and just pressure if someone presses on there. The symptoms usually come on fairly suddenly, but in rare cases they can occur gradually. And when we are talking about urinary tract infections, upper tract, lower tract comes to mind. And again, lower tract is bladder, in fact, it's the bladder only, and that's where simple cystitis is what I'm talking about. Or upper tract is affecting the kidney. Now, the causative agents or bacteria that cause simple cystitis include E. coli, that's the most common, Klebsiella, Proteus, and Staph. Now, there's a couple different tests available. A urine dip or dipstick, which is also commercially available, is a pretty simple test, and it's looking for leukocyte esterase or nitrates. And that alone, in addition to a physical, which is a pretty limited physical exam of the abdominal cavity and kidneys, can tell us for sure if you have simple cystitis. If for some reason we are questioning more than a simple cystitis, a urine culture can be available or ordered. And the reason a culture is ordered is because it will tell us exactly what bacteria is causing the infection and also the very specific antibiotic that can be used. So on to treatment. Treatment for a simple cystitis is antibiotics. Typical ones include Septra, Macrobid, Keflex, Augmentin, depending on patients' allergies and or medications that they're currently taking. The length of time one takes antibiotics can be anywhere from 3 to 7 or 10 days, depending again on the severity of the infection. Usually symptoms respond within 48 hours. Okay. And then for some, the symptom of dysuria can actually, after taking your first pill, within a few hours, you can feel some relief. The other analgesics are available. They're over-the-counter and prescription to help with that burning urgency feeling, and those include azostandard, pyridium, or Cystex. There usually isn't follow-up care that's needed for simple cystitis. A lot of times we'll diagnose it without doing the urine test, but if we do a urine test and there was blood in the urine initially, it is recommended that you have that repeat urine dip to make sure the blood is resolved, and that can be anywhere from 2 to 3 weeks after you finish the antibiotics. If you're a patient that's had several infections, lower upper tract, in a short period of time, you may be referred to a urologist. And lastly, the other follow-up care includes any kind of instructions that patients can go home with, and that would include just some basic knowledge on what a urinary tract infection is, how to treat it, what to look out for if things get worse. Okay, that's it. Hope you all enjoyed and have a great day.